All right, for everyone joining us, we'll give you just another minute to get settled and we'll hand this over to our presenters. All right, while everyone is logging in, we will go ahead and do some introductions. Just a reminder that this webinar is not for CPE credit. If you do have any questions, please feel free to use the Q&A box located on your menu bar, or you can use the chat feature. Any question that needs immediate assistance, I'll go ahead and answer. Otherwise, all questions relating to the presentation, we will hang on to the end. And we're going to turn it over now to Art and get started. Go ahead, Art.
Good morning, everyone, and welcome to the joint Eide Bailly HMWC webinar, the update on the PPP and EIDL SBA loan programs. I have my partners in crime to help me today. I want to introduce myself. My name is Art Wiederman. I'm a dental specific CPA, a partner with HMWC CPAs and business advisors in Tustin, California, in Southern California. With me today is Scott Haberman, who's a senior tax manager at Eide Bailly out of Fort Collins, Colorado. Next slide, if you would, Amy. Megan, we have Dan Bywater, who's been with us all of our webinars. Dan Bywater is a vice president of Ready Capital, which is an SBA specific lender out of Utah. And then we're again honored to have Megan Mortimer, who's the congressional lobbyist for the American Dental Association. And Megan has been unbelievable as far as providing us information. So we have we're going to give you our weekly update, and we're going to do some planning today on what do we do, because what we're finding is that money has been flowing. So as most of you all know, the Payroll Protection Program was funded by Congress on the 27th of March with the CARES Act with $349 billion. The program was opened up on Friday, April the 3rd, and on this past Wednesday of last week, the money was all accounted for and spoken for. So we're going to show you where the money went. We're going to give you as up-to-the-minute updates as you're going to get. Megan has been in close contact with the Treasury, and we'll talk about that. Where are we going? There appears to be a second bill coming down the pike. And then we're going to spend a good amount of time talking about, now you have the money, now what do we do? Because a lot of our clients have received funding. Scott, how many of your clients have you gotten calls from that said, I've gotten my PPP money?
I think I have about 10 so far received money. Yeah,
that's about where I am too. And so Dan, on your side you said you've got like 5,000 applications out. Is that what you told us?
Actually, we have almost 50,000 approved applications that have SBA funds secured.
Okay, and how many of those have been funded? Actually,
not very many. We're probably in the hundreds right now. Right now, we're going through the process of making sure we have everything we need for the application, uploaded documents, verifying the loan amount is within the correct realm, and then sending out loan documents to be DocuSigned. So it's a process that's largely determined on how quickly we can get to the file and how quickly they can get back to us with the information we need.
So this is actually perfect timing for everyone, because many of you have been funded, some of you have not. We're going to talk about all of the places that you could be in the queue. I would say, Megan, we can say with reasonable certainty that there is going to be more funding to this program. Is that you're pretty good with that?
I'm going to say 80% sure that by Thursday they will have passed something to provide additional funding.
Okay, so we'll get into all of that. And then we'll talk about planning for the spending and then paying your team before the office opens. So let's get right into our content. We got a lot to talk about today. So a little history again. Congress funded this program with $349 billion in appropriations, and they were committed in less than 2 weeks. And folks, to give you an idea of what the banks and the SBA had gone through, the SBA made more loans in 2 weeks than they had made in the previous 14 years. Think about that, 14 years. So, and I'm going to go through some statistics and show you some stuff that's actually, if you want to look at this, it's on treasury.gov. About 12% of the money went to the healthcare sector. And what's interesting is that 2/3 of the money went to about 200,000 businesses and 1/3 went to about 1.5 million. So Amy, if you would be so kind as to put up the SBA stats, and we'll show everybody just some information to show you kind of where this money went.
Sure.
Thank you so much. So, and again, this is on the SBA's website, everyone. So there were about 1.66 million loans, 342 billion, presumably that was through the 16th, and almost 5,000 lenders. So Dan, they brought in like 3,000 or 4,000 additional lenders just for this program, didn't they?
Oh, absolutely. Yeah, a lot of banks that normally don't process SB loans were pulled in.
And a lot of those banks, so yeah, didn't have the experience like that you have and some other SBA approved preferred lenders had. So, so this is a breakdown of who got the money. Obviously, use your imagination, folks. The bigger states got the most amount. So California had, actually California had the second most approved at 113,000 loans with 33 billion. So about 10% of the money went to California. Texas had more loans, but lower amounts. And, New York got a big chunk of it. So this is where the money went. Okay, Amy, if you go to the next. This is interesting because most of you that are listening to this webinar are probably looking at somewhere in the neighborhood of $100,000 to $300,000 for your PPP loan, unless you own multiple practices. So for that, about 31% of the money went to under $350,000 in loans. And that's about 1.5 million loans. But look at the bottom. I mean, you've got 220 billion of this money went to about 200,000 loans. So obviously, and as you can see, and Megan and I were talking about this, there's been some controversy out there as regarding that did the larger companies get easier access first to this money. I guess there was a lawsuit, Megan, filed in California yesterday, going after all the big banks and saying that, wait a minute, you gave the first choice of this to people at 500 and 400 and 300 employees. And now what about my dental office that has 7 employees? We were kind of put to the back. That's kind of what the lawsuit says. Yeah.
Along those lines, yeah.
Yeah. Okay. And then let's go to the next one. And then this is interesting. This shows you where the money went. So the construction industry got the largest amount, 13%. Healthcare and social assistance got 11.65% of this money. So again, the healthcare sector is a huge sector in our country. So, all right, let's go back to the, these are the lenders and they don't have names. So let's go to the next PowerPoint slide, Amy. Okay, so this slide is already outdated. Megan and I have been going back and forth, and Scott have been going back and forth for several days. So Megan, I'm gonna let you kind of jump in here and kind of see. We have another bill. Why don't you tell everybody kind of where we are and what is going to happen, and what do you think is going to go down here in the next couple of days?
So we do have another relief package deal that we seem to have coalesced around. Today, the Senate is going to meet at 4 in a pro forma session. So not everybody needs to be there. And they expect, although there's always, could be wrinkles or surprises, but we expect this bill to pass the Senate today at 4, this relief package. There's not much policy change in it. Most of it, 95% of it is just additional funding. And the policy changes don't really affect our clients and members. It's more agriculture and it's about testing, et cetera. And then we expect the House to vote on this Thursday morning. The House members will have to come back not all of them will, but enough to have a quorum, as we call it, in order to vote for this relief package on Thursday. We're not going to be able to do it under the unanimous consent kind of absentee voting we have seen in the past. So the bill, as we know today, the intel we've got, I haven't seen legislative text, but the intel we've gotten from the Hill is that it'll be $250 billion for unrestricted PPP, just straight for any PPP programming lender, et cetera. And there would be $60 billion allotted for smaller lenders. So $30 billion for assets less than $10 billion and $30 billion for assets between $10 to $50 billion. And that again is to kind of encourage the smaller lenders to take more of these loans on and participate in these programs, and also just a way to support smaller lenders and community banks. Then, as opposed to just the original thought of just injecting money into PPP, we are now seeing that they have come to agreement on EIDL as well. So this has $50 billion for EIDL, that is correct on the slide. But we're also doing additional $10 billion for the EIDL grants or advanced loans, as we call them. And then there's $2.1 billion for SBA administrative expenses so they can hire even more people to process, et cetera.
Yeah.
And then the rest of the bill has things for hospitals, testing, all of that.
I think you told me SBA is trying to hire 2,000 more people, some crazy number.
I mean, it's just every day I see advertisements for, do you want to come work for the SBA? Because it's just, they just need people, more bodies than they could ever have imagined. So.
Okay, so let's kind of talk about this. So you said it was in the email you said it was actually 310 billion total. So they added a little bit to it. And so let's kind of talk for a minute about where people are in the whole queue of this thing. So we've got people that their stuff is at the SBA, and I'll call on Dan here. We were talking about this before we went live. We've got people they're at SBA, but they don't have an actual loan number, right?
Yeah, there's really two groups of people right now, or three groups. There's people that have received their money. There's people that have an application that was approved by the SBA and they have what's called an SBA loan number. And then you have the third group where they might have sent in an application, but they weren't able to get an SBA loan number in time for them. So those are currently sitting at the bank waiting for this next round of funding.
Right. And the thing is, we don't know, folks. We don't know how much is sitting at SBA that's probably going to get approved, that's already going to eat into this $310 billion. So I don't know. I think the consensus panel, why don't you jump in? I mean, you think this money lasts a week?
I imagine I bet you it'll be gone in a week. I think the first few days, those SBA numbers are going to just be flying out of the SBA, and it's going to go much faster, I think, than this first round.
Yeah, because the banks have got when they first started this, all the banks had to get all their processes done.
Yeah.
This was brand new. Now they've got their processes done. They've had a couple of weeks to get their systems together, and now they're ready to process.
Well, and they have a major backlog of loans that were ready, but they ran out of money. So it's all going to start flowing very quickly.
Now, Dan, this is also interesting because you said before we went on live, you said that actually you don't think that even if someone has gotten an SBA number, they may not get their money for 7 to 10 days.
Yeah. So the big push right now, and the SBA obviously wants to get this money out quickly, and they said 10 days. And there's some confusion out there. I had a lot of calls this week of people saying, well, you approved me last week, and the SBA is saying in 10 days my money's going to be taken away if you don't fund it. That's not true. It's earmarked for you. It doesn't matter whether it's 10, 15, 20 days. The SBA put out that 10-day item out there to give banks kind of a blueprint of when they want the money out. The problem is that some banks are a little slower getting this out because of the amount of applications they've received. Also, there's still some confusion on the forgiveness part of the loan program, where they're hesitant to send out loan docs when they don't know what the forgiveness rules will be. So there's still some confusion with the program and some hesitancy to send out those loan docs and fund. So I think you're going to see maybe some customers out there where they have an application, they have an SBA number, they've sent everything they've needed to send to the bank, but they might go past 10 days. As these banks are trying to grapple with not only the volume, but a lot of the unknowns still in the loan program.
So I have a question, and then Scott, I don't know, maybe you've gotten some questions from your clients. I got an email this morning that said, Art, when we submitted, I'm a sole proprietor, when we submitted our application, I didn't add in the $100,000 for me because we didn't know if it was going to go. And then they added the guidance, which we reported on 30 minutes, which Megan, that was what we got 30 minutes before we did this last week. And now you can include that. So my question, Dan, would be, can we go back and say to you, hey, Dan, I got my application in, but I forgot my $100,000 for me, the owner of a partnership. Can we do that?
The good thing about this, and again, I'm speaking just for our bank, I don't know about the other banks, but a lot of our process was automated in the beginning. Now we're to that point where actual humans going to touch these applications and process them, and they're going to reach out and say, hey, we're missing this, or hey, here's the loan documents to sign. That's the perfect opportunity to say, hey, just so you know, I didn't know about this particular rule at the time I filled this out. Can I make an adjustment? We'd be more than happy to make the adjustment. What will happen is we'll send you a new application that you would just fill out, not to fill out the whole thing again, but just change the loan amount, re-sign it electronically, and then we'll start moving forward on it. So yeah, there's definitely is an opportunity there.
Good.
So if you've heard from your bank, or if you haven't heard from your bank, just reach out to them and let them know that they have some adjustments to make.
Scott, what have been some of your clients' concerns through this whole process?
What it comes down to now is really the forgiveness piece. You know, how do we get forgiven for all this debt? When does the clock start ticking? Are they really going to be strict on the 8 weeks if we're not open? A lot of unanswered questions that I think we're all looking for answers to, hopefully within the next week. And I heard that it's supposed to be by April 27th to have the final rules, but you know, if that gets kicked down the road, I wouldn't be surprised. But I think that's the major puzzle piece that we're missing right now is, you know, how do we get this forgiven, at least a majority of it?
Yeah. Megan, do you have any insight as to where SBA is on writing these rules, or do you have any idea?
I mean, you know, they came out lightning fast with the initial set of rules, and as we saw, that was fraught with a lot of problems. So I think that they're taking a little bit more time and being more diligent on the forgiveness part. Also, because people are concerned about the forgiveness 8 weeks, as I mentioned earlier, it's not like there aren't discussions happening about being a little bit more flexible about the 8 weeks and determining when that starts. And those discussions are out there. The ADA has pushed for that along with a bunch of other organized dentistry coalition members. So we are looking to see if there's going to be any sort of flexibility there as well. Perhaps that's part of their discussions moving forward. We aren't sure.
Okay. All right. Amy, go ahead and go to the next slide. All right. So let's get into the gist of this. So some of you have got your money. I mean, Scott said maybe 10 or 15 of his clients. I'm probably in about the same boat. So basically, let's just quickly go over the rules and what you need to do once you get your money. Okay. Scott, I think our general advice is, number one, to put it in a separate bank account, right?
100%. You got to track it separately.
And we'll track it separately. And we've got some tools that we're going to put up on the board here in a second. But without the guidance on April 21st of 2020, here's our thoughts. Is what the government, you know, I always go back to, if someone doesn't tell me what the rules are, I think about what was the purpose of this law. And the purpose of this law was to give you enough money for 8 weeks to pay your employees, your rent, your utilities, and your interest in exactly the same way, or as close to the same way as you can, had there not been a COVID-19 pandemic. So I went through this with a client the other day, and I said to him, I said, you need to put together a spreadsheet, which we've got for you. We've got these resources that we're going to be making available to all of our clients. So how much would you have paid your employees from the date you got the money for 8 weeks had there not been a pandemic? You know, and we'll go through this in a second. You know, and when these two amounts are calculated, are we going to be meeting 75%? So in order to get complete forgiveness, we have to have 75% of the money that you spend from this PPP loan has to be spent on payroll costs. And we're going to walk you through this spreadsheet, which is going to be the best way to explain it. And then are you going to have the same number of full-time employees on June 30th or at the end of the 8 weeks, whichever is earlier. And Megan, when we did our podcast, my podcast, The Art of Dental Finance and Management, Megan, you and I are on, and our ADCPA president, Alan Schiff, that'll come out tomorrow. And you had mentioned the earlier of June 30th or the 8 weeks. I hadn't thought about that, but that's what the law is. It takes a village, folks, to understand all this stuff. So Amy, can we go to the planner, the planner spreadsheet?
Sure.
And what we've done is we've put together a sample dentist. So this loan, this is a PPA loan plan template. So what we believe that everybody should be doing is, whether you've gotten the loan money or you haven't, if you're pretty sure, if you think you're going to get the loan money, or if you've been told, Dan gives you an email, hey, you've got it, it's coming in the next week or 10 days. So what we need to know is, how much did you get? This Dr. Wiederman here got $90,000, and his loan was approved on April 17th. So let's just say that he's going to get, on April 27th, he's going to get his loan funded. So on April 27th, that's when the 8-week clock starts to tick, notwithstanding what Megan mentioned, that maybe they're going to give us some flexibility, but I would not count on that. I would plan on the 8 weeks is going to start on the day that they put the money into your bank account. Now, folks, it's not 2 months, it's 8 weeks. So, Scott, when we talk about an IRA rollover, you got 2 months to roll it? No, you got 60 days. You've got 56 days. That's 8 weeks, 7 days a week. So that means that by June 21, we have to account for all this money. Now, if you go down the list there, Amy, well, not Amy, come back up to where you were again. I'm sorry. The loan is $90,000. That in order to get full forgiveness, we need 75% of that, or $67,500, to be forgiven, to be for payroll costs. And the other $22,500, again, folks, can go for rent, utilities, and interest on loans that existed before February 15th. So what we did is we created, if you could go down to page 2, Amy, we'll show everybody the assumptions we used. There we go. So in this practice, my office manager was and everybody works 4 days a week, because Scott, I guess the majority of my clients, I don't know about you, they're working 4 days a week, right? If you took a poll?
Yep. Take the Friday off, typically.
Right. Now, and I know that actually Eide Bailly put on a fabulous seminar yesterday to its entire client base, and they talked about that the SBA's definition of full-time is 30 hours. So let's just assume that these are full-time employees, 32 hours a week. So my office manager makes $30 an hour. My 2 clerical people up front make $25 an hour. My 2 chair sides make $22 an hour. And I have 6 days of hygiene, 4 days of a full-time hygienist making $50 an hour, $400 a day. In California, $400 a day is about right. Where Scott hangs out in Fort Collins, it might be a little lower, but again, we just use that. We didn't put, you're allowed to add your state unemployment tax, but being that we're going to be getting this money probably end of April, beginning of May, all the employees have already paid in the maximum unemployment. We put in that you're going to fund a 3% safe harbor match on a 401k plan, and that's going to be funded each month. The retirement piece of this, Scott, is, we don't know what they are going to do with this. Hopefully they'll tell us. And then we said $100 per employee per pay period, not including the doctor, $1,000 a month of interest, $6,000 a month of rent, and $2,000 a month of utilities. So Amy, if we could go back to the numbers up top to page 1 again, please. So what we did is we split this, so we get the money on the 27th. This is what we're going to recommend that you do, because what we want to do is, before we even spend a dime of this money, folks, we want to make sure that we're going to be right around this 75, 80%. So in my example, we're going to break this into 5 pay periods, from April 27th to the 30th, from May 1st to the 15th, from May 15th to the 16th to the 31st, June 1st to the 15th, and then June 16th to the 21st, which is the end of the 8 weeks. So as you can see, my office manager is going to make about $6,960 during this period of time. The clericals are going to make $5,800 each, the assistants $5,100, and the hygienist 5,600 and 11,600. And we can also put in the doctor. The doctor is allowed to make 8 50-seconds, which is 8 weeks out of 52 weeks in the year, of $100,000. Now, if you made less than $100,000 in your practice, it's 8 50-seconds of whatever your net income is. But most of you are going to be over $100,000. That number is $15,384. And doctors, you are allowed under the S corporation, LLC, and sole proprietor situation. Scott, correct me if I'm wrong. We all believe that 100,000 is allowed to be taken out. Okay. So in this case, I'm sorry, were you gonna say something? No.
Good.
So in this case, my total actual wages are $61,352 for this 8-week period. Remember, I borrowed 90, and I need to get to 67.5 in order to be at 75% for full forgiveness. Then I've got my 3% match, which I'm going to match on each payroll. That's $1,379. Again, waiting for guidance from the SBA. And my employee health insurance, which is going to be $2,450. So I've got total payroll costs right now in my plan of $65,181. I need $67,500, so I'm at 72%. And this tracks it. This is for the planning part. Then we're going to get to the actual tracking of what we do. Then I go down to interest, rent, and utility. So in Dr. Wiederman's plan here, we have spent a total of $65,181 for payroll costs and $18,000 for the other costs, the rent, the utilities, and the interest. So we have not spent in the plan $6,800. And you're going to say, well, Art, that doesn't make sense. I applied for what I'm going to spend. Well, number one, most of us didn't have the rules while we were applying. Number two, we don't know what numbers were applied for. And number three, we applied for 2.5 times payroll costs, and you're paying over 8 weeks. So you're never going to have exactly the amount of money that you would have spent. There's always going to be a difference. So what this tells me and what this tells Scott is, okay, so I got another $6,800 and I need to get in my plan over 75%, right? So this is where this is what I think all of you need to do now is work up the spreadsheet. We will have the template up for you probably in the next day or two to play with. It's an Excel spreadsheet. The great thing about an Excel spreadsheet is you can take it, download it, do a save as, and modify it. So this is the planning and again, for clients of Eide Bailly, call Scott and his team. They'll help you with all this. They'll work you through these numbers. There's planning. Some of you are going to say, I don't want to bring them all back right away. Or I'm going to bring this one back, but this one's not going to come back. You know, everybody's practice is different, but this is the intent of the law. I believe if you follow the intent of the law, that you will get your forgiveness. And for most of you, your first payroll is going to be April 30th, or your next payroll would have been April 30th. I sure hope we have guidelines by then. I hope so. We'll see. Okay, so this is the plan, folks. We need to get to the 75%. This spreadsheet will help you at the beginning to outline what your plan is going to be to make sure because that we get the forgiveness, because we don't want to go down and start paying a bunch of people and find out that at week 8, we've spent 47% on payroll costs and we're not going to get the forgiveness. Okay, Amy, if you would be so kind as to go to the next slide, which is the actual tracker. And I'll have another example here, which we'll do, but not the PowerPoint.
The other spreadsheet.
Yes, please.
Okay.
Thank you.
You're welcome.
Okay, this is our actual expense tracker. And what this does is this allows you to input into an Excel spreadsheet as you pay the money. So for example, and again, I use some different numbers here. This loan amount is $40,000 made to Art Wiederman, DMD, PC. Got, 10 employees. It doesn't matter. Just put these up for numbers. So basically, what we ended up doing is we ended up with the first payroll done on the 17th. and we put in 24,000. We paid 92, and this comes from your payroll reports, and we'll show everybody how to track this. $92 you paid in state income taxes. We took $800 out for health insurance from the employee's payroll on the 17th. But as you can see, on May 5th, we wrote our check to Blue Shield for $2,500. So my net amount is $1,700. We funded retirement. Money came out of a 401k for the employees' salaries, and then it was paid. So there's nothing there yet. So we paid $5,000 of rent in column 5, and we paid $350 of utilities in column 6. So after doing all of this, my $40,000 loan is down to $88.58, and this tracks every time you make an entry. So now we've spent $25,792 on payroll costs. That's 83%. So as of May 5th, we're in the good zone, because Scott, the good zone is anything over 75%, right?
Yep, over 75% for payroll.
That's right. So we are, Scott and I and our teams are going to have these available, and you guys can choose to take it and play with it, monitor it, because remember, this is what we're going to want to use when we get to the forgiveness part of this whole thing, which is going to be submitting to a bank. So I will tell you that we want to keep meticulous records. And so these are the tools. Number one, what we're going to advise you to do is, if you're going to be getting this money, if you've gotten this money, or even if you've gotten an SBA number, if you've got an SBA number, Dan, they're getting the money, right?
Yeah, they're going to get the money. Basically, like I said, it's kind of an earmark. It reserves the funds. So the only reason they wouldn't get money is if, for whatever reason, as they process the loan and process the application, they find something that makes it so they're not eligible for it any longer. But that's going to be rare, because the application is filled out and it should cover 99% of everything.
Right. So they're going to get this money. So if you think if you're going to get this money, or you've gotten the money already, I think waiting a couple of days is not going to break the bank here. I think if we look at the 27th and we don't have guidance, Megan, you're going to be screaming, I'm going to be screaming, everybody's going to be screaming, because we've got to start spending this money. Now, there's nothing in the CARES Act that I know of, Scott, Megan, that say that you have to spend this money every 2 weeks for payroll. It just says within the 8-week period. So again,
we don't have that guidance yet, and like Art put this wonderful spreadsheet together. Your bank might have a different documentation tracker that they want to see, but this is a really good, helpful handout to assemble that information and use it to track what is most likely going to be needed to submit for forgiveness. But it's all up in the air.
Yep, it really is. Okay, let's go back to the PowerPoint, Amy. And by the way, I want to throw a shout out to one of my team members, Henry Acetonian. Henry, I basically called Henry yesterday afternoon, and I said, I've got this idea for this template that I've kind of been working with some of my CPA friends, and Henry, I need you to make it really good and really pretty, and Henry did a great job. So nice shout out to Henry for helping us with that. Here's another example. PPP loan of $100,000, rent is $10,000 for 8 weeks, utilities are $2,000 for 8 weeks, front office $20,000, dental assistants $15,000, hygiene $20,000. Now, one thing we have to remember, folks, is that it appears that in the S corporation, C corporation, partnership, and sole proprietor, we are allowed to include the health insurance and retirement contributions for your dental team, but not for the owner. Is that everybody's understanding? Right. So so basically, and then we get the 850 seconds of 100,000, which is rounded 15,300. So let's go to the next slide, Amy. So again, just another example of how this works. And then we're going to get into what your options are at the end here. So front office, we're paying 20,000, dental assistants 15, hygienist 20,000, 5,000 employee benefits, 15,300 for doctors, a total of 75,300. I'm at 86.25%. I should get full forgiveness. I'm paying $12,000 rent, utilities, and interest, but I've got $12,700 left over. So now what do? I've spent all the money, Art. Scott, I've spent all the money. Let's go to the next slide, please. So what do we do? All right, we're waiting. Yeah, I think this is a common thing. We're waiting for SBA guidance. But if you have choices, if you don't spend the money, number one, do we give our employees a retention bonus? Are we allowed to do that? I don't know. You're not supposed to cut their salaries by more than 25%. But again, we're waiting for some guidance on that. You can return that extra $12,000, not use it. Just give it back to the bank. Or, folks, it's cheap working capital, 1% interest for 2 years. Although, interestingly, Megan and Scott, on the Eide Bailly webinar yesterday, the Eide Bailly partners and principals very aptly pointed out that the rule is 75% for forgiveness, but you're also required to spend the money 75% for payroll costs. And if you don't, theoretically, could you be subject to the fraud penalties? I don't think if you spent 74% on payroll, anybody's going to sue you for fraud. But we suspect that we want this money. The government wants you to spend 75% of this money on payroll. You may not need it, but again, it's working capital if they allow you to keep the difference for 2 years. But it is critical. Scott, how critical is it for meticulously tracking this money?
Yeah, I think it's going to be probably the most important part of the loan. I mean, the application obviously was a big deal, but forgiveness is even bigger. I think banks will be, they don't want to be caught up in the middle as well, and so you don't want to be subject to an audit. So make sure you keep those meticulous records. However, the SBA comes out with guidance, instructs you to do so.
Okay, so Scott, if an Eide Bailly client has questions, they get their PPP loan, should they be calling the partner they're working with? Should they be calling you? Who should they be? How should they engage?
Yeah. Reach out to your current CPA at Eide Bailly. We're more than happy to walk you through the steps. We have champions in every office who have been fielding a lot of these questions and have kind of formulated a brain trust of information gathering that we've been doing over the last couple of weeks. So reach out to your partner and we can all help you through the questions and the uncertainty that we're dealing with right now.
And for our HMWC clients, again, I've got my amazing team, Pam Chamberlain, Don Watson, Sam William, and everybody has been working really, really hard fielding all of your questions. I'm kind of the one in the group that's doing a little bit of this. We've had to, this is another thing, Scott, is I hear we also have to get tax returns done during this time, right?
Yeah, I forgot about those, but yeah, we still got those on the radar. Yeah.
Did the IRS just to say no tax returns? So Megan, I need you to call Miss Pelosi and tell her that the dentists we don't have time. What do you think? Think that'll work? Totally. There you go. Megan's a can-do lady. I can tell you that for sure. Anyway, so we have to do that. So, again, this is something that we're constantly working on. So we're kind of at our firm, we're kind of divide and conquer. So I'm doing a little more of this type of consulting. Pam, Sam, and Don. And there's Pam, Sam, Don, and Art. We only believe in partners and managers that have 3 letters. That's just kind of how it works in our neighborhood. But we'll get you all taken care of. I've talked to several of our clients about the strategy, but the strategy is so important. Okay. Let's go to the next because we want to spend a little time for questions. So paying your team before the office opens. We are getting, Scott, I can't tell you how many I'm getting calls. I don't want to take this money. It's a waste of money. Why would I pay people to sit at home? They can make more money on unemployment. I've flat out gotten calls from clients who have said, Art, I've got employees that are going to quit if they put me back on payroll. That's a philosophical discussion, which we don't have time to get into.
I think every doc that I talk to has that same thought going through their head that we're talking to them about.
Okay.
100%.
So I'm going to give you a little scenario. I have a client. It's one of Pam Chamberlain's clients. This guy's at the top of the class, and if he's listening, he knows I'm talking about him because I told him I was going to talk about him. He's in Orange County, California, and he said, Art, I brought my employees back from day one, 6 hours a day. I'm paying them, or it might have been full time. We've been working on systems. We've been working on training. We've been working on protocols, all the things that we don't have the opportunity to do. And we have called every single patient in our practice. And we're not asking them for an appointment, and we're not asking them for money. We're just saying, hey, Mrs. Smith, wow, this is unprecedented time. This is Megan from Dr. Wiederman's dental office, and we just want to. We're calling everybody. How are you doing? How are things going? How's your family? Is everybody healthy? You know, and you just talk to them. And even if you talk to them for 15 minutes, here's what my client, what Pam's client told me on the phone. He said, Art, we have talked to every single patient in the practice in the last 4 weeks. Everyone has been in the last 18 months. I've talked to many of them myself personally. And they all said, we can't wait till you get in. We can't wait to come back. And boy, nobody I do business with other than you has called me to see how I'm doing. Think about it, folks, the goodwill that you're going to build with your team, putting them back on payroll, and with your patients, calling every single one of them. You've got the time to do this. I mean, I know they're opening up parts of the country today, tomorrow. Megan, I don't know if you're closer to the government than any of us. I mean, I haven't heard anything about opening up the healthcare sector for dentistry anytime soon.
No.
No. So we're looking at another 2, 3, 4 weeks. We don't know, but you've got time to do this. And also CDC guidelines and all the things that you have to do, and then discussing and investigating for PPE requirements and research, sanitary equipment. I had a client, an oral surgeon client, who sent me a picture of a machine. It looked like CP3O in Star Wars, going spreading stuff all over the office. Megan, take a second and share. I mean, the ADA, I want to, again, a shout out to the American Dental Association, Dr. Gahani and Dr. O'Shawn, the executive director?
O'Laughlin, Dr. O'Laughlin, Kathy O'Laughlin.
Yeah, what amazing people. They are fighting tooth and nail for you, everything they can do to help the dental profession. Talk a little bit, Megan, about some resources the ADA has for dentists that maybe they might not know about.
Well, we do have a COVID page that has all of the resources that you might need. One thing I would like to note is over the weekend, the ADA did come out with guidance on masks and certain PPE equipment. And then we're looking even further beyond to determine if there are specific equipment that we need to recommend or that we would like to have people shy away from because we don't think it's legitimate in terms of the science. But yes, we do have a COVID page. There's a special breakout page just for the SBA loan programs that we try to update with ADCPA every couple of days. And as new guidance comes out, we try to update that as well. So you should just go, if you're an ADA member, to the webpage, go to the COVID page, and everything should be pretty easy to find in terms of what your specific question is. But if there is a question or a concern that you have that you don't feel is addressed, you can always reach out to me as an ADA member or any other member of the staff. But since you guys probably have my email easier, please feel free to email. I've already gotten numbers of emails from people who have watched this webinar and others that we've been on. So my doors are always open. My email is always open.
And Megan, you and Michael have been so giving and so helpful. I can't begin to tell you how you've got a place in ADA heaven someday, hopefully many years from now, for all that you have done for the dental profession, and the ADA is continuing to fight, and that's great. Protocols, just simple things, folks. There are webinars. I'm listening to webinars. What is this going to look like, folks? Remember, this PPP money gets you through 8 weeks. What do we do after 8 weeks? There's protocols. I'm going to be listening to a webinar at 5 o'clock today, put on by a very prominent group, and just trying to help our clients get ready. So, you don't want to get, your dental office is going to open on May 4th. And on May 3rd, you don't want to call your patients. You want to call them 2 to 3 weeks before, if we've got this notification of when we can open, and start talking to them. You can't wait till the day before. Again, the ADA website is a great place. I mean, I was honored to be on a webinar about 2 weeks ago with Dr. Gordon and Dr. Rella Christensen. My goodness. I mean, that's the gold standard out there. They're talking about all of the safety equipment and how to keep the offices safe and how to keep the patients safe. It's going to look a little different when everybody comes back. And I think that the number one thing that those of you who are listening to this webinar need to take home from today, obviously we want to get our PPP forgiveness, and Scott and I are going to do everything we can to make sure that you do. But the number one thing is we need to let the American public know that coming to a dental office is a safe, sanitary thing that they can do. And I know, Megan, you and I chatted a little bit over the weekend about this. And I know that ADA is working on things to put the word out to the public and put the word out to dentists. Your number one priority, folks, connect with your patients and do everything you can to let your patients know that it's safe, because this thing gets back to the way it was on March 15th as soon as everybody says, no problem, we can go to a dental office and it's safe. Isn't that right?
I mean,
Yeah.
we want it to be there, right? And we want, the ADA is working really hard on that communication plan as well, because we need to look beyond just the crisis time. You know, we want people to, like you and I have talked before, it's not always easy to get patients into a dental practice on any given day, let alone when they feel that going in might expose them to something. And that goes for the employees as well. The ADA is very focused on making sure that dentist owners feel comfortable, but also their hygienists come in and feel comfortable that they have all the PPE requirements they need for that. So, but we want people to feel like not only is it safe for you to come back, but it's very important that you come in, because you're probably 2 months overdue for a cleaning at least. And then anything that you've ignored for a while, you don't want to let it go farther.
And Scott, I think let's comment on this. It's really important that doctors connect with your Eide Bailly advisors, with your HMWC advisors, like, okay, so what if I don't get this PPP money? Some of you may not. Some of you may choose not to apply for it. You've got the retention tax credits. We're talking about that. But what's the plan? What's the financial plan so that when your office opens and maybe this PPP money is gone, how are we going to get through the next several months? Let's, plan for the worst, hope for the best. So Scott, we got to encourage our clients to call us and say, listen, let's take an hour, Art, let's take an hour, Scott, let's take an hour, Pam, Don, Sam, and let's talk about what does this thing look like between now and the end of the year? Because it's not just about the PPP money. I mean, we all want to get free money and we want it forgiven, and the government's giving us this opportunity. But, right, Scott, I mean, we got to get our clients. Have you had clients talking to you about some of this stuff?
Yeah, and that's what this goes back to I think our first discussion about the war chest, going back and seeing what's your runway until you potentially open back up again, because it's going to take a couple months to build up AR and to start collecting that cash to pay for expenses that you're essentially front loading for a few months. And so, we've been talking about that since I think day one of, all right, well, when you open back up, you're going to have a delay of cash received versus expenses paid. And so that's something that's very important to talk about right now when we get that open date on our radar.
Okay. All right, let's go to the next slide. I think that's it. So Amy, let's go to some questions. We got about 13 minutes left, 12, 13 minutes.
Yep, you're correct.
Okay, so let me see if I can get these. And hopefully we answered some of them. I've received nothing so far. Will there be money for those of us who've received nothing? I can't promise you. I mean, we think that the money is going to be there. They're putting out another $310 billion. But remember, it's not just dentists, it's restaurants, it's donut shops, it's dry cleaners. Everybody's going after this money. How can we use the forgivable amount? Can we use PPP loan funds for profit sharing contributions for 2020? The answer is your employee portion, yes, and we think it's probably going to be 850 seconds of what your profit sharing is going to be, but we're waiting for the guidance. Can we pay incentive bonuses to have people come back? I don't know yet. There's nothing in the CARES Act that talks about incentive bonuses. We think so. We don't know. General partnership, 2 S corps now include guaranteed payments. Yes. So we were under the impression we would apply for our own individual corporations, have PPP applications. So this is a good question. So Scott, we have partnerships. And in the interim guidance that came out a week ago today, it said that partnerships are to add $100,000 of their partner's money, partner's profit, into the employee's payroll costs. That's what it all said.
Mhm.
So it didn't say anything about a partnership of PCs. I mean, my consensus, this is a great question, is do we include the income for that corporate shareholder in the partnership? I don't think so. I've been advising clients to file a separate PPP application for the S corporation that's the partner of the partnership. Scott, is that what
Yeah.
you've been doing?
Yeah, and you essentially get to the same place anyways. So if you have the partnership that has $100,000 per partner and you didn't file for that before with application, and maybe you filed separately for your S corporation partners, you essentially get to that same place at the end of the day if everyone gets a loan.
Okay. All right, next question, Amy. I don't know if I can scroll down. Let's see. Can I? Oh, I can scroll down. Okay. Oh, let's see. Where am I here? 2 weeks ago, you recommended waiting to apply in order to potentially have the loan forgiven so we'd reopen. I don't know if we ever recommended waiting, Scott.
No,
I don't
day
think
one
we ever
was July.
recommended waiting. I just said, what we probably said was we recommended waiting if you wanted to take the chance that the money was going to be there, and if you wanted that money to have a better shot to be paid when your office opens. Revise your recommendation, said it was urgent. Applications in, but I haven't been approved. What are your chances? I don't know what the chances are. I honestly don't know what the chances are. I don't think, Dan, none of us know. I mean, it's really up to the SBA, and it's supposed to be first come, first serve. So, I mean,
the biggest unknown is we don't know how many applications that are ready for an SBA number are out there. There's no data out there with all the banks knowing how many thousands or tens of thousands are out there just waiting that as soon as that money is in the fund, that we'll pull a number. That's the big unknown. And I have a feeling, at least at our bank, there's a lot. So I imagine every other bank has a lot of pent-up demand.
We don't know. We just
We
don't
don't
know. The next question is the same one as the prior one that was basically corporation of partnership of S Corps. For the loan forgiveness, can we make a contribution to the pension profit sharing prorated for 8 weeks? The answer is yes, but we don't believe you can do it for the owner, just for the team members. Can we bring back some of the employees later in the process? Can we prepay a third month of rent? There's a saying out there that my late father taught me, pigs get fat, hogs get slaughtered. Can you prepay a third month of rent? Maybe. We'll see. It says in the statute, expenses incurred. Now, Scott, you and I are CPAs. We've been dealing with dentists for many years, so I don't remember what accrual basis accounting looks like. Do you?
Time to time, I have to go back to it.
Yeah, but for the most part, it's cash basis. But the CARES Act says incurred. What does that mean, incurred? We'll see. We got to wait for the guidance. We pay bi-monthly, but forbearance is based on 8 weeks. How will this work? Again, everybody's going to have to conform to the guidance, and I think that what we do is we act in good faith, and we pay people the way we would have paid people had they been working without a pandemic. And I can't see us doing any better than that. Let's see, Amy, you're moving this down. Why isn't doctors' health insurance included? Well, that's kind of what they decided. I don't shoot the messenger. I'm sorry, I didn't do it. I would have included doctors' health insurance, but it's not. Office manager, a team member, so yeah, they can be included. Let's see, if your first payroll run has 7 days before loan disbursements, I mean, yeah. I mean, again, all of these nuances of how do we figure this out and what do we put in, we've just got, Megan, we've just got to wait for the guidance. We don't know. Right now, here's what we know. We know that you have to pay 8 weeks of payroll costs. That's what we know. And we know what the period is, and that's it. That's what we know. Other than that, we just don't know. And once we get the guidance, I guarantee you on this platform, a week from now, 2 weeks from now, we're going to go through as much as we know. Okay. Let's see. Do sick days or vacations count? Yes. all compensation to employees count. But people can't work now. Well, again, we go back to the same conversation of, that's right, but the government wants you to pay your employees, right, wrong, or otherwise. And if that's the case, create the goodwill for your employees, call your patients, work on your protocol, look into all the equipment that you can buy, that you're going to need to make your place as safe and appealing to your patients as possible. 100% forgiveness. What if the employee decides not to come back? That's a great question. So, this is another thing, Scott, Megan, and Megan, I think you and I talked about this when we did our podcast over the weekend is, we have 6 employees on February 15th. One of them is pregnant, and by June 30th, they would have been out, and we're going to be down a little bit because of the pandemic, and they come back a little slower. So we're only going to need 5. And that's a legitimate business reason. Are we going to get penalized on the FTE calculation? We don't know. I would hope that they would make some provision in the guidance that if you have a situation where you don't have them come back because it's a legitimate reason, because they're pregnant, because they're sick, because whatever, that they would give us a mulligan on that. I don't know. Are you saying that we want to spend more than 75% for payroll? Yes, that's what I'm saying. Is that what we're saying, guys?
Yes.
75%. You have employees that don't feel comfortable coming back to work, and we go through the threshold. Yep, that's a legitimate concern. That's probably going to mean that you're going to need to try and find other people who are willing to work for you. But again, until we have this guidance, we just don't know. Okay, let's see what else we can get through here. You have to pay every single employee a minimum 75% of their average pre-COVID pay. Good question. Don't know yet. I don't think that's the case. It may very well be. I think if I remember in the CARES Act, Megan, I think it said we can't cut salaries more than 25%.
Right.
But I suspect that yes?
That's what it said in the CARES Act. Yes, you can't cut the salaries by more than 25%.
Right. So, but again, there'll be situations, what if your front office person decides they only want to work 2 days a week? Again, we have to wait for the guidance. How can we get our spreadsheets? So I suspect that these spreadsheets will be up on HMWC's website, which is www.hmwccpa.com. I also suspect that they will be up on Eide Bailly's platform, which is, I believe, www.eidebailly.com. Is that right, Scott?
Yeah. We have a COVID resource page there too, so you'll see that link on our website.
And so do we, and we have a PPP calculator, and I've written 6 articles for our firm. I'll be writing a 7th one probably today or tomorrow. Wells Fargo client due their past troubles. I was recommended to fill an application with another bank. So Dan, we have people filling applications with multiple banks, right?
Absolutely.
And that's okay, right?
Yeah, I would be very careful though not to submit applications to like 10 different banks, because if all those banks started trying to pull an E-Tran for you, it might trigger a fraud alert.
Right.
So I think 2 or 3 would be okay. So what would happen in that case is, let's say we received the application and a couple other banks did. If we pulled the E-Tran number first and got it, and when those other banks came in and maybe did it a day later, they would get a notice that number's been pulled already, and then they would just decline the application. So I think it's okay to have a couple of horses in the race, but don't put the whole herd through, because that could get you in trouble.
Okay, I'll take 1 or 2 more, because I think, Amy, we're getting pretty close to our time.
You have 1 minute.
Okay, then I won't take any more questions. Wow, that went real fast. Anybody have any closing comments they want to make? Okay, no?
Stay tuned. Stay
Yeah,
tuned for more information.
I just sent you guys the text of the bill, so.
Oh, okay. Well, I've got 30 seconds to read it. No,
it matches what we said, so that's good.
Okay, everybody, do your planning. Get with your Eide Bailly and your HMWC advisors. Let's do this together. We're all in this together. We're going to get through it. We're here to help you. And Megan, thank you so much. Dan, thank you so much. The 2 of you have been amazing resources. And Amy, next week next Tuesday?
Yes, next Tuesday, same time,
Same
same
time,
place.
same bat time, same bat channel, everyone. On behalf of my panel, Dan Bywater, Megan Mortimer, and Scott Haberman, and on behalf of HMWC and Eide Bailly, two fantastic CPA firms, thank you for attending today. God bless, stay healthy, and we'll see you next week.
Awesome. Thank you all so much for attending, and we hope you have a great day. Bye, guys.
All right, we're off the air? Nope.
No, we're not. Do you want me to set up a separate meeting so you can chat?
I don't know. I think we're probably okay.
Okay.
You guys need to